The honourable member for Lyne.
Yeah, thank you, Mr Deputy Speaker. The National Party is here, always here, defending the interests of our regional and rural constituents. Let's start with the first and our commitment to supporting rural and regional GPs. Just the other day we announced a general practice rural incentive program with payments, and I quote, if you're in a very remote or modified Monash 7 region, over 5 years you'll get $60,000 extra. That's much more generous to those general practitioners that turn up in regional towns. That is even better than what we proposed. It's not worse, it's better. Now, the pillars of the universal healthcare system, the Medicare benefit schedule, the pharmaceutical benefits advisory system and the subsidies on drugs, public hospitals, and soon, hopefully if we ever get it salvaged, a personally controlled e-health record. Now let's start with the public hospitals. Since the Coalition assumed responsibility for the Treasury benches, the increases to public hospitals, as quote the Treasurer, 6% increase over 4 years. That's a total of almost 25% over 4 years and $3.8 billion in real terms more for the states for their public hospitals. Now, the member for Maribyrnong has made a big song and dance about cuts, but $3.8 billion over 4 years is not a decrease. In fact, all of this argument about the so-called cuts to the states are based on calling a smaller increase a cut. To me, a cut means you get less than you got last year. It's like the guy who gets promised $100 a week pay rise from his boss, and then 2 weeks later the situation changes and the boss comes in and says, look, I can only give you $80 a week increase. Members on the other side would call that a $20 cut instead of an $80 increase. Simple principles. Don't hate workers. We support workers all over the place. Now, the pharmaceutical benefit system, 652 approvals versus 331. You know who did 652? Was it them? No. It was the Minister for Health who spoke just here earlier. The Ministry of Health has approved 650 new drugs since the Coalition was put in charge of administering the health system. $1.3 billion in the last round, $3 billion over 18 months. We've got new drugs for melanoma, cystic fibrosis, pancreatic cancer, eye disease, diabetes, multiple sclerosis, various forms of rare kidney disease and kidney cancer and breast cancer. And that's because we've managed the budget well. Now, the Medicare benefit schedule, there's over 5,500 items. We are criticised for damaging that system, but hey, people seem to have very short memories on the other side. The member for Sydney, the previous health minister, I think most of Australia wasn't listening. They'd given up on the Labor Party before the last election. But in the last budget that the Labor Party brought down for health, they criticised us for freezing the indexation. But hey, she froze it. It wasn't us. So that in itself was $667 billion out of it. The dental scheme, which has come up for criticism, I just looked at the budget papers before I came in here. The national payments for National Partnership on Health with the states amounts to $155 million. And the child dental benefit takes it up to over $200 million. Now, access to drugs also involves community pharmacy agreement, which the minister and the ministry has just completed with the
this one will work.
with the guild.
This one's going to work.
And the pharmaceutical industry continues to the pharmaceutical community continues to negotiate, and there will be hopefully a complete resolution of the funding arrangements. So look, whether you look at one pillar or all of them,
Order.
the
Order. The
facts
honourable
are-
member's time
the
has
facts are
expired,
that
and I